This program contains subject matter and language that may be disturbing to some viewers. Viewer discretion is advised. So, aside from being the anorexic and bulimic fat kid, I also have a pretty severe drinking problem. Um, at the moment, I'm in kind of a gray space. I'm between getting help and going to rehab. I probably will be in a inpatient rehab within a week or two. And right now I'm just kind of venting out frustration of getting help because I did everything I was told to do in a 12-step program. They said, ask for help and it will be there. Well, I asked for help, and apparently, in AA they always say you're only as sick as your secrets. Well, in reality, you're only as sick as your insurance. And my insurance says that I'm peachy fucking keen. So, they're like, what are you willing to give up? Well, apparently, my punishment for being competent and holding a job was that I couldn't get adequate help, so I had to quit my job and go on medical assistance. Medicaid for the rest of you. And, go to the county facility, and, they're going to try to place me somewhere, and they will, but it's going to be a week, and I don't know how I'm going to make it a week. I can't make it 3 hours, I can't do it. And I'm kind of at the end of my rope. And I know it's bad when even believe me, it doesn't relieve the pain. Starvation's out of the question because when you're drinking, you can't starve, and at least for me, I can't. And the binging and purging is not helping. So, my parents are probably ready to throw me out of the house, and I can't blame them. But I have nowhere else to go, and I feel like I've been holding back. I don't know if anyone can relate to this, but I feel like I've been holding back tears for months, if not years, and I'm just waiting for a professional, like someone to listen, somewhere where I can just cry to. And I don't feel like it's okay to cry to the people around me because they have their own tears over me. So I'm stuck. And, I can bitch about the system and the insurance and that whole nonsense, and it's a legitimate bitching session because it sucks. When I called for intake, they're like, well, by 2014, because of Obamacare, it'll be fine. Yeah, I voted for Obama, and Obamacare's great, but I don't think I'm going to make it to Friday. Today's Wednesday. And I don't know what to do. I need a cigarette. Where the fuck is my lighter? And y'all don't need to see this, but I'm just digging around and can't find it. Oh, there it is. And so what does this have to do with my series on eating disorders? Well, my primary problem is a toss-up between which professional you ask about me. If you ask my counselor, I have an eating disorder and I have bipolar disorder. Happens, they run together. If you ask my drug and alcohol counselor, I have a drinking problem. If you ask my nutritionist, I am bulimic. And so, when so many people with so many credentials give you so many different answers, who are you supposed to believe? What are you supposed to say? I went to a detox over the weekend, and if you've never been to detox, make every effort not to have to go. It's lousy. It sucks. I was in there with all the bums, and I don't like the word bum, but I was in there with them, and I felt like a bum. I hadn't shaved, I hadn't showered, I was in the same clothes I'd worn for days. And as soon as my alcohol level came down, they threw me out and said, "You're fine, go ahead." Um, and every doctor I've seen since, and I've seen a few, has said, keep drinking, do whatever you have to do before you get into rehab because you'll have a seizure. Well, my parents, rightfully so, don't trust me. Um, when I say the doctor said this and the doctor said that, um, because they think, well, no one dies of seizures. I'm like, well, okay, well, I don't want to die either, but just my general frustration is that when they say, ask for help and it'll be there, it's not always there. It's not like A&E's intervention. It's not like as soon as you ask for help, boom, you're on a plane. You've got to wait. You've got to be patient. And I have to make it for another 7 days before I get the medical help I need. And I am not sure that I can do it. And I'm not sure how to cope with that. And um, normally I would have tears, but the fact that I take so much psych meds, I'm just numb. I'm numb. I'm sure other people can relate, but um, I'm running out of things to say.